The pec minor is the modern reason for shoulder pain. That's just my opinion in my practice of what I've been finding with so many of my patients. And what I'm helping to do is help other practitioners to not become frustrated, neither their patients or themselves, in trying to address new shoulder problems that we really haven't seen over the years. I'm going to explain in this video why I believe that the pectoralis minor is the problem, that it is the root cause, and that we might be massaging muscles that truly aren't the culprit. So what I want to do is I'll show you superficially from an anatomical position why I believe that these muscles are becoming hypertonic. Then we're going to go to the charts, and I'll address the origins and insertions of these particular muscles so we get a really good grasp on why that pec minor is pulling the scapula out of alignment and causing these problems with certain muscles. And then we'll go down to the table and I'll actually demonstrate how I do the massage on the patient to help the pectoralis minor. So let's go through the whole thing together. So the superficial anatomical position should be a person standing upright and their palms facing outward like this, or like in a supinated position. That would keep the shoulders healthy and back. We basically just call that good posture. So we look at our patient, and the patient should be able to swing their arm nice and comfortably through that sagittal plane. That would be a normal way to walk, right? Let me get rid of this pen here. But this would be a normal way to walk. But what we're seeing now, because of modern society, the playing of video games, the texting, working at computer stations, even with our truck drivers that drive long distance, we're seeing a rounding of the shoulders. So the shoulders are coming forward. And now, instead of the arms swinging in that sagittal plane, they can't because of the glenoid cavity's position has changed. Now we see the hands swinging obliquely, like this. Now what does that do? When we have this unnatural position of the shoulders forward, the biceps brachii, the long head in particular, the way the tendon passes through the intertubercular sulcus onto the glenoid tubercle, supraglenoid tubercle by the way, it's putting undue pressure on the tendon. And so when we go down, I show you on the chart how this actually takes place. You'll say, well, why would the humerus stay in that unnatural position? Well, we got a muscle that's actually making that take place. In the past, we thought it was a subscapularis. It was a tight subscapularis that was pulling the shoulder into internal rotation. But we're realizing that almost on everyone that has this issue, they have a tight pectoralis minor. Okay, so we're looking for the shoulders rolling in. That's the first observation you're going to make of the patient when they come in. If you see the shoulders in, or while they're laying flat on their back on the table, when they're on the massage table and they're laying flat and their shoulders are still elevated, you know, they're not even heading posterior, then we know that we probably have a tight pec minor. But we'll discuss that later. We're going to first go down to the charts and we'll show you there. So we're talking about the biceps brachii. It's probably one of the most underrated muscles for shoulder pain. Everybody focuses on the rotator cuff muscles. We know that. But we want to focus on the biceps brachii because many people, I'm amazed, even some 13-year-olds are having problems, some of my athletes, right there at this point of insertion. So we see here, there's the intertubercular sulcus of the long head, where the long head of the biceps brachii passes through. Actually, this is a better picture over here. Let's go over to this one right here. You can actually see the tendon passing right through between the greater tubercle and lesser tubercle of the humerus right here. So it passes through here, fits nice like a saddle there, and then we have the supraglenoid tubercle there. So this long head is where we'll see a lot of tendon stress on our patients. They'll complain about a pinching pain, and it'll get blamed on supraspinatus, or it'll get blamed on another muscle. But this is actually the muscle or the tendon that's causing problem from the muscle itself. Now, if we look at this picture here, here is the pectoralis minor. Now we know it originates on ribs, but it inserts on the coracoid process. And this is going to become something very, very important to us because this coracoid process has two muscles of origin and one of insertion. Now the two muscles of origin are going to be, if we go back to this picture here, it's going to be the short head of the biceps brachii. So it's going to insert on the coracoid process of the scapula, right? Coracoid process of the scapula. But another muscle does that too. This one over here, the coracoid brachialis. It also inserts on that coracoid process of the scapula. So we got two muscles that originate off this coracoid process. But the one that I really care about is the pectoralis minor, where it inserts on it. Because when this pectoralis minor engages and shortens, it pulls the scapula into protraction. It's a protractor. It's a synergist with the serratus anterior. So they both are protractors of the shoulder, the scapula itself. However, if this muscle is tight, if it stays tight, if it stays fixated, then the humerus has to follow the glenoid cavity, that change in position, which means internal rotation of the shoulder. So if this is tight, it's going to pull on the scapula right there, which means if we go over to this picture, which means that this particular saddle now is, or tendon in the saddle is going to be offset, and the pressure is going to be in here more medially on it, on the anterior surface of it. So this is where the pain's going to be, but we're going to be, we focus on this tendon, right? So we do cross fiber friction here. We do a lot of thumb pressure to help it. But the reality is this is the muscle here. This is the muscle here that's actually causing the problem. Because if it's tight, it's pulling it forward. So if you hold the camera up to me, and I'll demonstrate again. So if the pectoralis minor is tight, originates here up to here, inserts there. If it's tight and it's pulling the scapula into protraction, because that's what it's supposed to do, right? It's the punching muscle. If it's there, the humerus will follow. Do we see that? The humerus will follow. It has to. It has no other choice. Otherwise, you're just going to wear out that cavity itself. So if the humerus is turned inwardly like that, then we're going to see an unnatural positioning, kind of like that tendon will pass through, and all of a sudden it's offset, and then it's dragging and it's wanting to fall off like that. So we keep going to this, thinking this is where the problem is. We're trying to reduce inflammation, and we will temporarily. We will temporarily reduce inflammation by doing massage in that area, but that's not the root cause, is it? No, that pec minor being tight is what's pulling the humerus into internal rotation and keeping it that way. And it's because, like I said before, it's our modern way of living. The texting and the shoulders being forward. So we need to address that pectoralis minor. We got to get it loose, and if we do, the scapula return to its true anatomical position, a good posture, head high, right, shoulders back. And when we do that, now it takes pressure off that tendon. It's sitting in the right place, and it's going to be much, much healthier. So let's go down to the table, and I'll demonstrate how we work on the pectoralis minor. So the first thing we want to do is identify where the pectoralis minor would insert, and so we know that it originates on ribs, and we can kind of see where the shoulder makes a change right through here on the anterior surface. So most people have a little bit of a rounding here. You can kind of follow the clavicle all the way down, and you just kind of palpate until you find a protrusion right there, which is the coracoid process of the scapula. And what we do is as I palpate and I find that process that sticks out, you can just make a mark in it in your mind. So I just drew that right there. But this is where the pec minor comes in and then inserts right there. And that's really easy to remember because we have two flexors of the arm itself, the main part of the arm, the upper arm, which is the coracoid brachialis, and the biceps brachii. So we know that it flexes the arm, right? Also, the biceps brachii flexes the elbow and supinates the hand. We know that. But the important part is how we get into this and find how hypertonic it is. And the way I like to do that is I put my thumb right in that area and I just drive my thumb in. Just like that, I drive my thumb in. And you will feel, if it feels like guitar strings in there and it's super tight, there's no flexibility in it, you know you got a super tight pectoralis minor. Now the way I like to massage it is several ways. One, I'll just use my thumb and I'll do rounding circumduction. I can do side-to-side friction on that. That's going to help. You can use the arm to your advantage. So if you don't want to, just constantly crush your own grip, you can take the arm itself or close to the elbow, and then you can move the arm in circumduction while just pinning the pectoralis minor. And I can feel it popping right underneath my thumb there. So we can do circumduction. We can go back and forth and force cross-fiber friction this way. And then we can stretch the pectoralis minor by applying this pressure and supinating the forearm like this. And we just can come back to find out what their range of motion is or how tight it gets. Now, an excellent way to stretch the pectoralis minor, this is one of my favorite parts, is to make a fist like this and lift the arm up and get it behind the scapula. You can probably see my fist there. I'm right behind the scapula. And what I can do is I can, this shoulder now is elevated, right? I can take the shoulder now and I can force the stretch. You got to be real careful. If they're super sensitive or they're really, really tight, we don't want to cause any tearing of the tendon itself. But right now, she's at her maximum range of motion right here. This arm should come back much, much further than 90 degrees. It should come all the way to the top of her head. So this particular patient here has a very tight pectoralis minor. And so when this individual has shoulder pain here, they're going to think it's from the deltoid, or they're going to think it's from the rotator cuff muscles. But it is, in fact, the pectoralis minor. That's the problem. So I will do this stretch. I will hold this stretch up underneath this shoulder like this. You want to just continue to supinate the arm. You can have them actually press against your hand and then release, and you can do that for 30 seconds. But getting them in this comfortable position, doing the friction, doing the circumduction with the hand or the arm, along with the stretching, is going to bring so much relief. And all of a sudden now, you're going to see their shoulders going back. Now, another thing you can do is I like to use palm pressure on the shoulder itself. So what I'll do is I'll take my palm of my hand, take that thenar eminence of the hand, and drive it into the shoulder and just go straight down. So see how the shoulder's going down? I'm just pinning the shoulder down. So this arm is completely loose. I'm pinning it down. That right there brings a tremendous amount of relief to a lot of our patients. They feel it and they go, wow, that hurts, but it feels so good to have that shoulder go back into its proper anatomical position. What we can do is the same thing we did with the thumb, is we were rotating the arm, doing a little bit of this, or side to side. We can do the same thing while we're holding and pinning that shoulder down, and we get a much greater variety of the muscles. We get several of them in there. You even get a little bit of the pectoralis major in that, and you're getting the deltoid to stretch also. But this pinning of the shoulder can bring so much relief, and I'll usually hold it for 30 to 60 seconds and then start moving the arm in different directions. Let the patient communicate to you what feels really good and what really hurts. And when you find what really hurts, and we're looking for good hurt, by the way, not the tearing of the actual muscles themselves, but when they let us know where the good hurt is, then we can just continually reposition our palm of our hand. Now, the more advanced clients, more advanced patients, we're going to take the knuckles of our hand, then we're going to push them into that particular area like this, and we're going to use our straight forearm, and we'll drive into that, and now you're really going to stretch those muscles, because now the knuckles are going into the pectoralis minor. And then when you move the arm, I can't even do it to her, she's going to fly off the table. But now when you move the arm and you feel that grinding and that stretching and that breaking up of fascia and that if there is any scar tissue from previous injuries, you're going to feel it all just breaking loose. You'll feel it right on the tips of your knuckles there. So those are going to be the basic ways. You can give them the home stretching on how to do it. Of course, there's tons of videos on how to stretch your shoulders and get things to open up. But we have to release that pectoralis minor. That's the goal. Now, after we do a lot of work in this area, there's going to be slight bruising. You're going to see a small bruise on a brand new patient. Once they've had it done several times, the bruising will come to an end. But the first night, I recommend cryotherapy in that area. Tell them to take a Dixie cup of ice, rub that shoulder down when they get home, and that'll bring down the inflammation, because we are going to be bruising tissue to get there. You know, we have to. There's just no way around it. But once we dig through there, loosen this up, we're going to have a happy patient. Well, I hope you enjoyed that massage tip for massage professionals. Again, my name is Doug Holland. If you enjoyed this, please hit like and subscribe. It means a lot to me. It motivates me to make more videos. And until next time, just remember this. If there's no discomfort on the table, we're not really helping our patients, are we?